Hello and welcome to your Harrisburg Area Community College Blended Learning EMR program. James Weber here to work through a little bit of content in regards to medical emergencies. There are some common medical conditions that you may be called upon to be able to have to help a patient through, right? So it's important to have a working idea as to what those are and really what an EMR can do to help address them. Angina pectoris, right, which is a fancy medical term for chest pain, right? Heart attack, dyspnea, asthma, stroke, hypoglycemia, diabetic coma, lots of different examples of abdominal pain, lots of different examples of medical conditions that you might be called upon to address, right? We've got to have an idea as to what to do about each of them. Emergency medical responders can prepare to treat these patients by doing the best you can to study signs, symptoms, and treatments of each condition. So we talked a little bit about the medical emergency medical assessment sequence, right? So scene size up, primary assessment, history taking, secondary assessment, reassessment. And the assessment that you're going to learn during your lab sessions, right, matches this sequence through National Registry. This sequence is a super important sequence to 100% memorize, know, and deeply understand. Patient assessments of medical emergencies. Biggest thing is going to be review the dispatch information, right? Carefully assess the scene to identify safety issues. As you perform the primary assessment, try to form an impression of the impression of the problem first, then determine the patient's responsiveness, introduce yourself, check the ABCs, and acknowledge a chief complaint. Usually, it is best to obtain a medical history on a medical patient before you perform a secondary assessment. Use that sample history format, obtain the patient's vital signs, monitor the patient through ongoing reassessments, and make sure you reassure the patient wherever you can. General medical conditions. Some of them might have different causes, yet have similar signs and symptoms. So it's important that we have a working idea as to what the individual signs and symptoms are so you can help differentiate between different medical problems. Initial treatment can help stabilize a patient until other EMS or hospital personnel can take over for that patient. Automental status. Automental status is either sudden or gradual. It really depends on the patient presentation, but it's just a sudden or gradual decrease in the patient's level of responsiveness, right? Use that AVPU scale we talked about before, alert, verbal, painful, or unresponsive, to help determine kind of what their current mental status is. And it allows for you in that circumstance to begin to trend to see if there's changes, right? Because when you reassess the patient in 10 minutes, and their mental status is worse than it was when you first assessed them, it gives you a working idea that you're beginning to see changes with that patient, right? When assessing the patient's mental status, consider two factors. The patient's initial level of consciousness and then a change to that level of consciousness. Conditions causing an altered level of consciousness: head injury, shock, decreased level of oxygen to the brain, stroke, slow heart rate, and high fever. Conditions causing an altered level of consciousness: infection, poisoning, low level of glucose, right? Low blood sugar, insulin reactions, and psychiatric conditions can cause altered mental status. The initial treatment is to maintain the patient's airway, breathing, and circulation and normal body temperature. Keep the patient from additional harm. That's pretty important. And if the patient's unconscious and has not sustained trauma, place the patient in a recovery position or use an airway adjunct and be prepared to suction, right? We need to be prepared to suction this patient. Seizures. Seizures are caused by sudden episodes of uncontrolled electrical impulses in the brain. Generalized seizures produce shaking movements, involve the entire body, last 1 to 2 minutes, and leave patients unconscious. Generalized seizures caused by sudden high fever, things like febrile seizures, occur in infants and young children. Absent seizures, it generally only results in a brief lapse of consciousness. Often, we don't even realize that patients had a seizure, right? They may blink, they may stare vacantly, they may jerk one part of the body, commonly referred to as an absent seizure. So again, generalized seizures caused by sudden high fever, infants and children primarily. Absent seizures can occur in anybody in the primary symptomology is that they may blink, they may stare vacantly, and they may jerk one part of the body, but only has a brief lapse in consciousness. With seizures, we're going to monitor the patient's ABCs and arrange for a transport. Seizures can be caused by epilepsy, trauma, head injury, stroke, and shock. Seizures can be caused by other things too, like decreasing the level of oxygen to the brain. Pretty common. High fever, right? Not uncommon for children to have those seizures caused by high fever. Infection, poisoning, overdose of drugs or alcohol, brain tumor, or infection. How about diabetic emergencies or complications to pregnancy? So really, there's just a ton of reasons why somebody might have a seizure. The treatment's generally pretty common. Usually the seizure will be over by the time you get to the scene, right? It's pretty rare that you get to the scene and the patient's seizure is not over. And if that seizure is not over when you get there, that's actually a pretty significant problem. If it has not ended, focus on protecting the patient from injury. Once the seizure stops, ensure an open airway and place the patient in a recovery position. Seizures. Now, the treatment for seizures is pretty kind of important because we can have some pretty significant problems with airway breathing as it relates to seizures, right? So, if the patient doesn't resume breathing after that seizure, begin that mouth to mask or mouth to mouth breathing we talked about in some of the assessment lectures. Administer supplemental oxygen as soon as it's available. After the seizure, move the patient to a more comfortable and private place. Specific medical conditions. You will find it helpful to be knowledgeable about some of the more specific medical conditions you might encounter as an EMR. This information will help you assess, treat, and communicate more effectively with patients. Heart conditions. A heart must receive a constant supply of oxygen or it'll die, right? The heart receives its oxygen through a complex system of coronary arteries. These arteries may narrow as a result of atherosclerosis. Progressive atherosclerosis can cause and frequently causes angina pectoris, heart attack, or subsequently cardiac arrest. Angina pectoris. Chest pain caused by inadequate flow of oxygen or blood to the heart muscle defines angina. It is often described as a pressure or a heavy discomfort. Patients are often shortness of breath, sweating, frightened, and have an impending sense of doom. Ask the patient if they're already being treated for a heart condition and has nitroglycerin. Assist the patient with taking a pill or administering a light aerosol spray. If the pain is not lessened 5 minutes after their first dose, help the patient take another. If the pain has not lessened after 5 minutes after that second dose, assume the patient's having a heart attack or ensure they get transport promptly. Heart attack. Heart attack results when one or more of the coronary arteries is completely blocked, right? Two causes of coronary artery blockage: severe atherosclerosis or a blood clot. Pretty significant stuff. Signs of a heart attack include things like patient has immediate pain, right? That pain often will radiate from one side of the chest to the left arm, to the left arm to the back to the jaw. But there be some sort of kind of radiation between one of those three areas. The patient's normally shortness of breath and will be weak, maybe sweaty, maybe nauseous, and they may vomit. If the blocked area is critical or large, the heart may stop completely. Complete cessation of the heartbeat is called cardiac arrest. Defer back to your initial training in CPR. Take the following steps. Summon additional help. Talk to the patient to relieve their anxiety. Touch the patient to establish a bond and reassure that patient. Take the following actions. Move the patient as little as possible. Place the patient in the most comfortable position. Help the patient take an adult aspirin or 2 to 4 low-dose aspirins. Administer oxygen if it's available. Prefer to administer CPR. And if the AED is available, have it brought to the patient in case it's needed. Congestive heart failure. CHF is caused by failure of the heart to pump adequately. The failure is in the heart muscle itself, right? But the congestion itself is in the actual blood vessels and vasculature. Signs and symptoms of congestive heart failure: breathing difficulty, rapid shallow breathing, right? Moist, gurgling respirations, profuse sweatings. Those enlarged neck veins are pretty profound. Sometimes that's swollen ankle, right? That's a real good one to look for. Shortness of breath, swollen ankles. Often that's a patient with congestive heart failure, as well as anxiety, right? As well as anxiety. Take a few actions. Place the patient in a sitting position with legs down to drain some of the fluid back into the lower parts of the body. Administer oxygen in large quantities at a high flow rate. Summon additional help and arrange for prompt transport. Dyspnea, shortness of breath, or difficulty breathing, usually associated with a serious heart or lung disease. Heart-related causes, things like angina pectoris, heart attack, and CHF. Other causes, pulmonary disease, such as chronic obstructive pulmonary disease, emphysema, chronic bronchitis, pneumonia, and asthma. Right? Common terminology to refer to that as dyspnea, but it's really that shortness of breath with multiple causes. Generalized treatment for dyspnea, that generalized treatment for shortness of breath. Check that patient's airway to make sure it's not obstructed, right? Because it's an obstruction, that's a really easy fix. And defer back to your airway chapter on our discussion of the Heimlich maneuver and removing some of those obstructions. Check the rate and depth of breathing. Place the patient in a comfortable position. Provide any reassurance you can. Don't forget to make sure you take care of the patient's emotional state as well, right? Provide that reassurance. Loosen any tight clothing that they have. It'll help. And administer oxygen if you have it. Asthma. Asthma is an acute spasm of the air passages associated with the excess mucus production and swelling of the lining of the respiratory passage, right? It can be caused by a couple of different things: allergic reaction, emotional distress, exercise, respiratory infections. Lots of different things that can cause that asthma. Asthma attacks have killed a ton of people in the United States. 3,630 people in the United States in 2013. It's a significant issue, right? Patients will have difficulty exhaling, and wheezing sound will generally be heard. Follow the treatment steps for dyspnea and instruct the patient to perform pursed lip breathing. If ALS isn't available, initiate or request prompt transport. Stroke. Stroke is the leading cause of brain injury and disability for adults. Most strokes are caused by a blood clot that blocks blood supply to that part of the brain. Couple of different key parts, things like signs and symptoms. Headache, right? Somebody says they have a headache, and specifically the worst headache they've ever had in their life that started very suddenly. That is something to be concerned about as it relates to a stroke. Numbness or paralysis to one side of the body, dizziness, confusion, all things that are considered important signs and symptoms. Drooling. Inability to speak, difficulty seeing, unequal pupil size, unconsciousness, seizures, respiratory arrest, incontinence, unresponsiveness, and especially when you see multiple signs like this at the same time. All of these signs, or multiple signs presented in the same patient, are a really good indication the patient's having a stroke. Use that Cincinnati pre-hospital stroke scale to determine whether the patient might have experienced a stroke. Doesn't require any special equipment. And we're going to do a separate video in regards to Cincinnati pre-hospital stroke scale. Or you'll capture it in your lab session. It's either going to be in a video or in your lab session, one of the two. It requires no special treatment to do that stroke scale, and it gives you an idea as to whether a patient's having a significant stroke pretty quickly. Table 10.1 in your book goes over the different parts of the Cincinnati pre-hospital stroke scale, so it'll give you at least a good working idea on how to perform this test. Treatments for stroke. Biggest thing is going to be maintain an open airway, right? Administer oxygen. Should be high flow oxygen. Non-breathing face mask. And it should be at that 15 liters we should be administering that oxygen. If a patient's having a seizure, try to prevent further injury. Be prepared to administer rescue breathing. Place a unresponsive patient in the recovery position. We talked about that during some of the body positioning and body movement lectures, right? Position the patient in that recovery position. Provide emotional support, right? Don't forget that emotional support for patient having a stroke. This is a condition that scares the crap out of our patients, right? So it's vitally important that we acknowledge the fact that it's a little emotionally jarring when suddenly you can't speak normally. Suddenly you're slurring your words, and you know you're slurring your words, and there's nothing you can do to change it. We've got to get this part right. Some patients can be treated with drugs to dissolve a blood clot in their brain, and it's really going to hinge on rapid transport, right? We've got to request that rapid transport pretty immediately. Diabetes. Diabetes is caused by the body's inability to process and use glucose, right? The body produces insulin, which is able to move into the individual cells, right? Insulin actually is the key to allow that sugar into individual cells. If the body doesn't produce enough insulin, the cells become starved for glucose because they don't have that key to actually enter the cell. Hypoglycemia occurs if the body has had enough insulin but not enough glucose, right? Too many keys, not enough sugar to go in the cells to match the keys. Signs and symptoms: pale, cool, clammy skin, weak, rapid pulse, dizziness, headache, confusion, unconsciousness, sweating, all examples of symptoms of hypoglycemia. Hunger and rapid onset as well. A patient experiencing hypoglycemia, they might appear to be drunk, right? If the patient is able to swallow, have him or her eat or drink something sweet. Hypoglycemia, if a patient's unconscious, open the airway and assist with air breathing and circulation. Don't give them something to eat, right? Don't give them something to eat. Diabetic coma occurs when the patient has had too much glucose but not enough insulin, right? Too much sugar but not enough keys to get that sugar into the cell. Signs and symptoms, things like history of diabetes, right? Warm, dry skin, rapid pulse, deep, rapid breathing, fruity odor on the patient's breath are all examples of diabetic coma. Signs and symptoms, weakness, nausea, vomiting, increased hunger, thirst, urination, slow onset of symptoms of diabetic coma, right? Diagnostics are common. It's not always easy to figure out between low blood sugar and high blood sugar. We also make some mistakes as well as it relates to the difference between diabetic and stroke, or diabetic and person who has drank too much alcohol, right? Diabetic and drunk is hard to figure out the difference between. So identifying the differences between those things are one of the more complicated things that we do, and it's important that we identify that mixed diagnostics are pretty common in those couple of different diseases. These are some examples and comparative points between blood sugar that's too high or diabetic coma, or blood sugar that's too low, right? Just some comparative samples, and you'll find this in Table 2 in your book, Table 10.2 in your book. Diabetic coma, in general, give conscious diabetic patients sugar by mouth and arrange for prompt transport. If the diabetic patient is conscious, arrange for prompt transport, right? If they're unconscious, get them moving. If they're conscious, we could try to give them food. We could try to give them sugar by mouth. If they're unconscious, right, we just want to immediately begin to move towards rapid transport. Abdominal pain. The contents of the abdomen are divided into hollow and solid structures. Hollow structures are really tubes which contents pass, and solid structures produce substances themselves. Abdominal pain is a common complaint that we hear from patients, so it's important we have an idea as to how the abdomen works. Acute abdomen. Acute abdomen is caused by irritation of the abdominal wall. May result in infection, maybe pain. Abdomen might be hard as a board, might come with nausea, vomiting, fever, diarrhea, so it's important we have an idea as to how that works. We see a lot of acute abdomen, and it could be any one of a bunch of different things, but generally caused by irritation of the abdominal wall. Some patients will vomit blood because they're bleeding from the esophagus or from the stomach itself if the patient has abdominal pain. Monitor vital signs, big thing. Treat for shock should you see signs of shock. Because patients with abdominal pain, the reasons for that abdominal pain may be something that will soon lead to shock, so continue to reassess for shock and then treat for shock when you find it. Abdominal aortic aneurysm is just a cause of acute abdomen, right? It's when one of the layers of the aorta becomes weakened, right? And it can actually blow, and the amount of blood that's in the aorta itself, when somebody blows a AAA, they generally do not survive. It can be a very life-threatening situation for a patient. Risk factors: beatus, high blood sugar, high blood pressure, right? Atherosclerosis and heavy smoking makes you absolutely 100% a significant candidate for abdominal pain. Treatment for AAA, place them on their side, treat them for shock, handle them very gently, right? Because if you handle them too rough and they have that moment where they begin to blow and rupture that AAA, they will not survive. So it's vitally important that when you think a patient's having a AAA, to just be very cautious, right? It's going to make a difference for the patient in the long run. Kidney dialysis, some patients have kidney disease, unable to filter waste products in their bloodstream. Many patients with chronic renal failure must have dialysis treatments, right? Those dialysis treatments is where basically we have a machine that cleans the dirty waste products out of the actual blood itself. Most hemodialysis patients have a shunt implanted in their arm or their leg. It's just a surgically created connection between the artery and the vein itself. If they've got a shunt, you just got to be mindful as to which arm you take that blood pressure in. You do not want to take the blood pressure in the arm with the shunt. Patients may experience emergencies related to dialysis treatment. Low blood sugars, or low blood pressure is common. My apologies, because the amount of fluid that's removed, as well as shock, internal bleeding, changes in electrolytes, and some really funky cardiac rhythms. It is pretty important to just be mindful of what dialysis is and how it can affect your patient. So pay attention to that section of the chapter. A quick summary of what we discussed. General medical conditions may have different causes, yet result in similar symptoms. Usually, it's best to collect a medical history on the patient experiencing a medical problem before you perform the physical examination. Altered mental status is a sudden or gradual decrease in the patient's level of responsiveness. When assessing a altered mental status patient, use the alert, verbal, painful, or unresponsive scale. Seizures are caused by sudden episodes or uncontrolled electrical impulses in the actual brain itself. Specific medical conditions include angina, heart attack, congestive heart failure, dyspnea, stroke, hypoglycemia, diabetic coma, and abdominal pain. It's a bit of a rundown on your chapter on medical emergencies. Should you have any questions, reach out to your program coordinator. We appreciate your time, patience, and energy. And as always, we look forward to seeing you at our next discussion. Have a great day.